My name is Jeremy Aragon, and I'm going to talk to you about the direct oral anticoagulants for thromboprophylaxis in ambulatory patients with cancer. First definition. Patients with cancer are more likely than patients with developing cancer in the veins, seen in the lungs, or in the deep venous system. Chemotherapy increases the risk even more. However, bleeding at the site of cancer localization and a relative decrease in the number of platelets in the blood caused by chemotherapy may result in a greater likelihood that cancer patients will develop bleeding complications when using agents anticoagulants. Application in nursing. Studies have been carried out to assess prevention strategies with the aim of finding a cost-effective prophylaxis method not only from the economic point of view, but also in relation to the hemorrhagic risk. The profit margin is very variable if we consider how the procoagulants and the pro-hemorrhagic elements change in the evolution of the patient. Pros and cons. Oral anticoagulation based on decoumarin has several aspects to highlight when indicated in the oncological context. On the one hand, its administration should be avoided in patients undergoing systemic treatment with drugs that alter their metabolism, such as methotrexate. On the other hand, the difficulty in maintaining the international standardized rate within a range of isocoagulation with patients with an active oncological disease is recognized. Issue applied in Ecuador. Remember that 1 in 5 patients with venous thromboembolic disease has cancer, and 1 in 10-20 patients with cancer will develop a VTE. And in conclusion, primary thromboprophylaxis with HPBM significantly reduced the incidence of symptomatic VTE in outpatients with cancer treated with chemotherapy. However, the lack of statistical power hinders the possibility of establishing definitive conclusion about the effects regarding the main safety results, which requires additional studies to determine the risk-benefit ratio of HPBM in this context.